Hello, I'm Dr. Brianne Christiansen, holistic dentist at Brighton Dental in San Diego. And today I'm going to talk about a very common issue, a very scary issue, and something that a lot of people have to go through. So here's the situation. You just found out that one of your front teeth has to be pulled. Losing a tooth at any place in your mouth is scary, let alone one of the teeth right in front. So what now? How do you go through this experience without losing some pride and feeling humiliated? We take for granted how much our teeth contribute to our looks. Good or bad, they're a dominant part of your face. When you smile, when you speak, when you laugh. Now that you have to lose one, what are the options? This is what I'm here to discuss. I'm here to give you some confidence that this is a problem many people have to deal with, and I guarantee most of us wouldn't even know it was going on to someone we knew. I'm going to tell you what the process for every option is, when each option is recommended, and how you will survive the treatment without missing a front tooth the whole time. Some vanity is healthy, and I understand that. At Brighton Dental, I not only put your oral health first, but do so in a way that you are comfortable. So remember, each case is different, and some treatments listed here aren't always suitable, but I will try to generalize them. Let's start with the first case. You have a front tooth that needs to come out. Either you broke the tooth had a root canal that failed, or there's some other reason that the tooth cannot be saved. It has to be pulled. How do we replace it? The most ideal way to replace a single missing tooth is with an implant. When the adjacent teeth are healthy, an implant is always my #1 recommendation. If the tooth has not yet been pulled, it's more likely that the bone present is sufficient enough to support an implant. Now it is up to your dentist to judge if it is appropriate to place the implant right after the extraction. If the implant is placed immediately, it is most likely that the implant will need some time to heal before it can be restored. If we decide to wait to place the implant, it is usually because the amount of bone available is not ideal, or the infection present is more than we are comfortable with placing an implant into that same area. So in that case, we place a bone graft, close the area, and give it a couple months to heal before reopening it and placing the implant. So what replaces the missing tooth in the meantime? We call it a flipper. The flipper is an acrylic prosthetic that replaces your single tooth, and it's made by the lab before you come in to have the tooth pulled. This way, when the tooth is gone and the space is empty and you have to go through 1 to 3 to 4 months of healing time, you have something temporary to wear while you're waiting for everything to finish. Implants are traditionally a 3-step process. First, the implant is placed and usually given 1 to 3 months to heal. In some cases, the implant can be immediately loaded with the crown. In that case, at the appointment when the implant is placed, an abutment, which is the part that the crown cements onto, is placed onto the implant, and a temporary crown is also placed onto this abutment. And then an impression is taken eventually and sent to the lab, and your new crown comes back to be cemented. If the abutment is not placed at the same appointment as the implant, it usually takes 1 to 3 months to have the abutment placed, an impression taken, sent to the lab, and then your crown comes back 2 weeks after that to be cemented. Again, once the abutment is placed, a temporary crown is placed for the 2 weeks while you're waiting for the permanent crown. One other point I would like to make is that for ideal aesthetics, it is extremely difficult to match a single crown to the rest of your teeth perfectly. In some cases, if a lot of staining is present or a difficult shade is on the adjacent teeth, I recommend veneers to achieve a beautifully uniform smile. Option number 2 is a bridge. A bridge requires the adjacent teeth to be crowned, and a crown called a pontic connects those 2 crowns to replace the missing tooth. This is also a great option when the teeth on either side of the missing tooth have large fillings or crowns already. So here's how the appointment goes. The teeth next door are prepared for crowns. After this is done, the tooth that needs to be pulled is pulled, and a temporary bridge is then made. The temporary bridge is cemented on and replaces the missing tooth, so you leave the office as if nothing changed. In 6 weeks, enough healing has taken place for us to take the final impression. This final impression is then sent to the lab, and in 2 weeks you have a permanent bridge that is cemented in place and yours to keep for the life of your teeth. Bridges can be a little trickier to clean. You have to make sure that you're able to floss through and under the Pontic. But as long as you take good care of the bridge, it will last just like any of your crowns. So another option is a removable partial denture. This is typically my least favorite option because it does not have the same function nor the best aesthetics. It is similar to the flipper I talked about earlier, but a little bit sturdier. I rarely recommend this option when we're replacing a single tooth, but it may be a decent option if you already have missing teeth in that same arch. Remember, this partial is removable. That means you have to take it out at night to allow your tissues to rest. It can sometimes move while you are chewing your food, laughing, or speaking. When this option is selected, we take impressions, and the partial is then made by the lab so that it is ready for you the day your tooth is extracted. You leave the office with a tooth. Again, the options I gave you are very generalized. Dentistry is great because we can get creative and have a little fun with every option, so don't feel like you're limited to just these 3 situations. So now that I've gone over these, I hope you're a little less afraid of what's to come. I hope you feel that we at Brighton Dental care about your situation and want you to be comfortable and confident that we are going to restore your smile to what it was or even make it a little better. If you think you have to lose a front tooth or already have, please call our office for a consultation to see what we can do for you. Believe it or not, losing your front tooth is not the end of the world. There are so many ways we can make it unnoticeable. No one would even have any idea of what's going on. Thank you, and I look forward to seeing you in our office.